Colorado's ICU capacity so dominates our conversations about whether people can go to the hospital and get care if they need it, we can lose sight of what is really a parallel capacity crisis these days: psychiatric beds for young people. The pediatric mental health care system in our state is beyond crisis. Here's Steve Steger.
Our system was at capacity prior to the pandemic, and the pandemic has just made things really worse.
It's no secret that kids are struggling. Jason Williams sees that struggle in real time every day.
We're full. We've been 100% capacity for the last 2 years. We have an open bed, it gets filled.
Williams heads the Pediatric Mental Health Institute at Children's Hospital, Colorado. His numbers are only for children's, but they speak volumes for the entire system in our state. Since the start of the year, between 15 to 40 visits to the emergency department each day at Children's are kids in a mental health crisis. At one point, it was the #1 reason kids were ending up in the ER there.
From the start of the year through mid-October, there have been more than 5,000 emergency department visits for behavioral health across our system. I described it at one point as a tsunami that hadn't hit the shore, and we were waiting for this wave. The tsunami is now hit in multiple waves.
Their feeling of isolation, loneliness, not belonging, and in Denver in particular, the suicide rates for young people are twice the nation's average.
Dr. Carl Clark leads the Mental Health Center of Denver. He says the pandemic is pushing kids to the brink, but he also says that solutions are on the table.
There are a lot of early intervention programs where we work with young people to learn about, dealing with stress, dealing with connections.
Children's is actually using the crisis as momentum for change.
The curse and the blessing of COVID is the need for behavioral health interventions has never been higher. But elected officials are seeing this and hearing this, from their constituents. And so there's tremendous will from Democrats and Republicans at the local level, the state level, the federal level.
Dr. Clark says a well-meaning piece of public policy years ago might have contributed to some of the stress on the system. There was a push to keep kids out of residential psychiatric facilities and keep them in home care. And that meant a lot of residential facilities closed. So in some cases where a kid might be beyond needing hospital care but still needs some extra care, Kyle, they're staying in the hospital for a bit longer and they're taking up those beds that maybe someone who just needs to get into the hospital for hospital care actually might need.
This is a moment in this country where we're prepared to spend some money and take some time to fix things that don't work right in the healthcare system. What are the chances that can extend to this problem?
So Colorado has a task force right now looking at how to spend about $450 million, Children's Hospital pushing to try to take a third of that, which represents about the population of Colorado. About a third of the population are young people, and invest that into systems to try to fix this problem. It's been around for a long time.
Yeah.
The difference this time around is that people are actually willing to talk about it.
Sure, and we know the toll that the last 2 years has taken on kids especially. Steve, thank you.